Good afternoon, my name is Simeon Williams. I will be presenting my capstone project, Plant-Based Dieting in Healthcare, for my BSN class in Evidence-Based Practice. So the objectives for this project are to be able to describe the existing gaps in providing evidence-based practice as far as dietary education, especially when it concerns plant-based dieting and using it to contain non-communicable diseases. Also being able to describe experiences that we as nurses encounter while using dietary choices to improve our patient outcomes. Also being able to brainstorm in order to identify appropriate dietary patterns to promote better health outcomes in our patients. Introduction to plant-based dieting. Understanding what plant-based dieting is an umbrella term to diets that consist mostly of fruits, vegetables, grains, legumes. Many of these diets are referred to as vegan diets, vegetarian diets, even the Mediterranean diets that main focus is on natural food sources, plant-based sources. Not all diets exclude meat, some allow it, and some also include dairy products as well. Vegetarian, plant-based diets, vegan diets, they all have very healthy benefits. They offer essential vitamins and minerals that are necessary for our health and well-being. And with such a diverse plants and vegetables, these are diets that just need to be well planned to ensure adequate nutrition from all food sources. So there are problems that comes with poor dieting, and highlighting these points highlights why plant-based dieting is so important. One of the non-communicable diseases at the forefront is obesity. Eating a healthy diet along with getting physical exercise is definitely important key in preventing obesity and reducing obesity. The CDC tracks this trend very well. A little over 70% of adults over the age of 20 are either overweight or obese. Many of these obesity causes puts our patients at high risk for developing heart disease, diabetes, and even some cancers. Heart disease is the leading cause of death in the United States, one of the leading causes of death in the United States. And it is easily on its caused a lot by the high sodium intake that consists of that is in the main diet that is in the United States, which is the Western diet, which heavily focuses on meats and processed foods and does not involve very many plant-based options, vegetables and fruits. The leading cause of heart disease and stroke is high blood pressure and high cholesterol. These are common problems that come into the hospital and are due to poor dieting, high fat, high sodium diets. Many of our patients come with hypertension, and patients with hypertension have two to three times more likely to get a stroke compared to those without hypertension. Diabetes is another non-communicable disease that's ever growing. As obesity rates increase, and so does diabetes. Many of those who are overweight develop insulin resistance, and patients with high blood pressure and diabetes are even at an even higher risk of developing a stroke, and even more so a lethal stroke, fatal stroke. Many of the processed foods that are eaten and the sugary drinks that are consumed daily by many Americans, we just taken much more sugar than our body needs, and that also contributes to the damaging effects of that happens to our bodies, that leads us to becoming diabetic. And diabetes also has a incredibly damaging effect over time to our nervous system and our circulatory system. And cancer, an unhealthy diet can increase some cancers. Overweight and obesity are associated with cancers in premenopausal women and colorectal cancer. And that has a lot to do with what we put onto our bodies. With a Western diet that's predominant in the United States, it's high fat, high sugar, high sodium, and while these things are good, Americans in the Western diet consume far too much of it and not enough nutrition, which leads to a lot of these non-communicable diseases and the sicknesses that come with them. So the significance of plant-based dieting, the significance of plant-based dieting is eating healthy can definitely help with our patients with chronic diseases and poor health conditions. Eating foods with low and saturated fats, high in fiber, and getting access to low sodium foods can help prevent high blood cholesterol and reduce blood pressure. It already aids in cutting out the excess bad fat, sugar, and salt is a good start. But vegan and vegetarian diets, these plant-based diets, are healthy and nutritionally adequate, which is a big part of our diets that's lacking. And health benefits that are in the prevention and treatment of certain diseases. It's very good for helping patients with weight loss, because not only do they eat healthy or not able to lose weight, they are still getting those vital nutritions that help their body heal and grow. Plant-based diets are associated with reductions in blood pressure as compared to omnivorous diets such as the Western diet that is very predominant in the United States. And it helps in the overall management of hypertension. So for this, my capstone project, my Peacock question is overweight adults who are 25 and older, how does consuming a plant-based diet compared to a low-fat, low-carb diet affect weight loss and cardiac health within 6 months? And so the focus of this question was to highlight how a nutritionally dense diet is far more beneficial, would be far more beneficial than focusing on just a low carb diet or a low fat diet, which only focuses on minimizing caloric intake or minimizing fat intake and not focusing enough on getting the nutrients that are even more vital to the body as far as helping it heal, helping it grow, and helping it remove waste. These nutritions that we get from plants are definitely much needed, and focusing on them could definitely help treat a lot of non-communicable diseases. So dietary non-adherence is a big problem when it comes to helping our patients learn more about plant-based dieting, understanding nutrition, and implementing dietary plans to help our patients understand and follow better dietary patterns. Many patients that have chronic diseases, many of them are very non-compliant with their diet. A lot of them come in frequently, even after dietary education, still eating poorly. So non-adherence to dietary advice presents one of the greatest barriers in implementing dietary education and programs. It's difficult to create programs and follow patients when their patients continue not to be compliant with their dieting. So further studies are essential to creating a better understanding on how to educate and present dietary advice to prevent non-adherence to dieting. Nursing interventions that will aid in avoiding dietary nursing interventions that help in compliance to dietary advice. First and foremost would be telephone follow-ups. This is following up with the patient and to check on their progress and see how they're doing. Also be able to give them advice and help them adhere to their dietary plan, their dietary advice, helping them understand the consequences of reverting back to poor eating habits. Feedback is another nursing intervention that follows along with telephone follows up, understanding how well the patient feels about their dieting, how their concerns, and this gives us a window to be able to intervene to give support, or as in the other intervention, nutritional tools, being able to provide something simple such as nutritional charts or charts on healthy foods they can eat. And so because many people don't know which foods to go for, allowing them to have something very simple to refer to make it easier for them to stay compliant. Also even calorie trackers or weight trackers. These are little tools that aid in to give the patient something to work with to help track their progress and help to keep them on track. Videos is another good nursing intervention. Many patients have lower literacy levels. Some patients they are giving a instruction packet when they are discharged, and it's just a lot of reading and words, and many may glaze over it. Videos provide an intervention allowing patients to get very complicated content in a very simple video. And this is a very good intervention for many patients, as it can cover a variety of topics very simply. And even in patients who have difficulty cooking, being able to create refer them to very simple videos about putting meals together, focusing on plant-based dieting and understanding the content in very layman terms. Contracts is another nursing intervention as well, working with the patient and helping them be responsible for maintaining their compliance, helping them set small achievable goals so that helps them stay on track with their dietary plan. One of the studies that I went over was effects of vegetarian diets on blood pressure lowering. This was a study that compared plant-based dieting, vegetarian diets, against non-vegetarian diets and its effect on lowering blood pressure, and it helped show how plant-based diet had a significant effect on blood pressure lowering than non-vegetarian diets. And this is a study that can be applied for nursing education to help patients dealing with poor cardiac health and obesity. And the next study is the effect of low-fat and low-carbohydrate diets on weight loss and lipid levels. And this study helped to focus on understanding how low-fat and low-carbohydrate diets are beneficial. However, there are drawbacks because it has shortcomings, as it does help with weight loss, it does help with improving some lowering cholesterol. However, it's not a diet that is sustainable over the long term, whereas a plant-based diet, where it's nutritionally dense and it's a diet that's not just a diet that you will be on for a certain amount of time, it's a diet that you can take over your lifetime, and helps your body heal and repair and function more fully. And it shows a comparison of these diets. And so finally, I go over the reasons for non-compliance with many of our patients, especially when it's concerning plant-based dieting. First and foremost, poor nutritional knowledge. Many of our patients don't understand why plants that we eat, plants, fruits, legumes, are so important. Many do understand that they have nutritions in them, but don't understand the whys and the benefits of it. Insufficient access to produce is also another one. Some patients live in areas where fresh produce isn't so readily available, and these are interventions that require a multidisciplinary approach to aiding our patients to be able to get the resources they need. Patients may have difficulty cooking or do not know how to cook. And that is another barrier, as some patients are elderly and do not know, and are unable to cook, and other patients just are not good at cooking, and that deters them from pursuing a plant-based diet, which would involve cooking at home and putting meals together rather than going out to eat. Which finally leads into the last reason for non-compliance is competition with easy-to-access foods, and that puts a focus on many processed foods, fast foods, even going out to eat, which many of those meals are calorie dense and not nutritionally packed commonly. And it's easy to get those foods already put together, they taste good. And many patients who may have a difficult time with plant-based dieting, cooking at home, eating healthier, they would gravitate toward this. And so these are all things that we as nurses need to focus on as we work to promote healthier eating, plant-based dieting, understanding why nutrition is so important, and helping our patients have better outcomes. Thank you very much.